If you're over 65 and someone has told you to just try magnesium or just take some ashwagandha for your stress and anxiety, stop for 1 second, because that advice, without the right details, could either do nothing for you or actually cause you harm. I'm Dr. Anthony Fauci, and in the next 20 minutes, I'm going to walk you through exactly which natural remedies for stress and anxiety actually have real clinical evidence behind them for people over 65 specifically, not for 25-year-olds, not for general wellness influencers, but for your body, at your age, with your medications and your risk factors. I'm also going to tell you which one of these popular supplements has triggered enough liver safety concerns that several countries have restricted or banned it, and chances are it's sitting in your medicine cabinet right now. No sponsorships in this video. Nobody paid me to rank these. I'm going through the research the same way I go through it with my own patients, and by the end, you'll know exactly where to start, what to avoid, and what questions to bring to your own doctor. Let's get into why stress after 65 is genuinely a different animal than stress at 40. Here's what nobody really explains to people. Stress itself doesn't change much as you age. What changes is your body's ability to recover from it. When you were 40, a stressful week might cost you a bad night's sleep and a headache. At 65, that same stressful week can spike your blood pressure for days, disrupt your blood sugar, worsen joint inflammation, and quietly chip away at memory and focus, because your stress response system, the one running in the background of your body every single day, has lost some of its elasticity. That stress response system has a name, the hypothalamic pituitary adrenal axis, or HPA axis for short. Think of it as your body's internal alarm system. It decides when to release cortisol, your main stress hormone, and, just as importantly, when to switch that alarm back off. In a younger body, the alarm goes off, does its job, and shuts off cleanly. In an aging body, that shutoff mechanism gets sluggish. The alarm rings longer than it needs to, and cortisol stays elevated longer than it should. So let's actually talk about what cortisol does when it lingers like that, because this is the part that connects everything else in this video. Chronically elevated cortisol after 65 has been linked to several things that matter to you directly. Disrupted sleep architecture, meaning you might sleep 8 hours and still wake up exhausted. Increased abdominal fat storage, even if your diet hasn't changed. Suppressed immune response, meaning you catch things more easily and recover more slowly. And, this is the one that worries my patients the most when I explain it, sustained high cortisol has been associated with accelerated changes in brain regions involved in memory. This is exactly why natural calm isn't just a nice to have at this stage of life. Managing your stress response is brain health, heart health, and immune health all wrapped into one. So let's talk about what the evidence actually supports. Let's start with the one I recommend most often, because it has the cleanest safety profile of everything on this list: magnesium. Magnesium is involved in over 300 processes in your body, and one of its lesser-known jobs is regulating that exact HPA axis we just talked about. It helps your nervous system switch from alert mode into rest mode. The problem is, magnesium deficiency becomes more common as we age, partly due to reduced dietary intake, partly due to certain medications, including some blood pressure drugs and acid reflux medications, which deplete magnesium over time. Here's the detail that matters. Not all magnesium supplements are equal. Magnesium oxide, the cheap kind you'll find at most pharmacies, is poorly absorbed and mostly just gives you a laxative effect. The forms with better evidence for sleep and anxiety are magnesium glycinate and magnesium L-Theanine. Glycinate tends to be gentler on the stomach and is well tolerated by most older adults. I am not going to give you a blanket dosage number in this video because the right amount depends on your kidney function, and if you have any degree of kidney disease, magnesium can actually build up to unsafe levels in your blood. This is the single most important sentence in this section. If you're over 65, ask your doctor to check your kidney function before starting a daily magnesium supplement. It's a simple blood test, and it's the difference between a supplement that helps you and one that quietly works against you. Now let's move to the one everyone's been asking about: ashwagandha. Ashwagandha is an adaptogen, a category of herbs believed to help the body adapt to stress rather than targeting one specific symptom. And to be fair to it, the clinical research is genuinely encouraging. Multiple randomized, placebo-controlled studies, including ones specifically conducted in adults aged 65 to 80, have shown measurable improvements in sleep quality, general well-being, and stress scores compared to placebo, typically using around 600 milligrams of root extract daily over several weeks. A broader systematic review and meta-analysis published in 2024 reinforced that ashwagandha shows real, measurable effects on stress and anxiety markers, not just placebo response. So why am I not putting it at the very top of this list? Here's the part of the story most supplement videos conveniently leave out. Since 2023, multiple countries, including Denmark, the Netherlands, France, Belgium, Germany, and Poland, have raised formal safety concerns or restricted ashwagandha sales due to reports of liver injury. As recently as this year, researchers have been publishing follow-up safety reviews trying to understand exactly who is at risk and why. The current thinking is that liver injury appears to be rare, but it's not zero, and it appears more likely in people who already have some liver vulnerability, which becomes more common, not less, after 65, especially if you take other medications that are processed through the liver. My actual recommendation for my patients: if you want to try ashwagandha, get baseline liver function tested first, especially if you're on other medications, and don't combine it with other liver-processed supplements without your doctor knowing. It's not a reason to panic, it's a reason to be specific and careful, which is exactly what being 65 and up requires from all of us. Let's talk about the adaptogens that get far less attention but deserve more: Rhodiola, holy basil, and lion's mane. Rhodiola rosea works a little differently than ashwagandha. Where ashwagandha tends to be more calming and sedative, Rhodiola tends to be more energizing, which is why it's typically recommended in the morning rather than at night. Clinical reviews describe Rhodiola as having a long track record of helping with stress-related fatigue specifically, the kind where you're stressed and exhausted at the same time, rather than stressed and wired. For older adults dealing with that heavy, depleted kind of stress, Rhodiola is often a better fit than ashwagandha. Holy basil, also called tulsi, has a gentler evidence base but a long history of traditional use, specifically for what's sometimes called adaptogenic balance, helping both mood and blood sugar regulation simultaneously, which is particularly relevant if you're over 65 and managing blood sugar concerns alongside your stress. It's typically taken as a tea or capsule and is generally considered to have a mild, low-risk safety profile, though as always, if you're on diabetes medication, your doctor needs to know you're adding something that can also affect blood sugar. Lion's mane mushroom is the newest name on this list to most people, and it works through a different mechanism entirely. It's been studied primarily for supporting nerve growth factor production, which relates to cognitive support rather than direct stress hormone regulation. Recent research has been exploring its role alongside other botanicals for brain health and mood together rather than as a standalone anxiety treatment. Think of lion's mane less as calm me down right now, and more as support my brain's resilience over the months ahead. And then there's L-Theanine, which might be the most underrated tool in this entire list for one specific reason: it's fast. Where adaptogens like ashwagandha and rhodiola typically take 2 to 4 weeks of consistent use to show effects, L-Theanine, an amino acid found naturally in green tea, tends to work within 30 to 60 minutes, producing a calm, alert state without sedation. This makes it a useful option for situational stress, before a doctor's appointment, before a flight, before a family gathering you're dreading, rather than a daily foundational supplement. It has one of the cleanest safety profiles of anything we've discussed today, with very few known interactions, which is part of why I'm comfortable recommending it more freely than the others. Now let's talk about the one thing in this video I want you to actually take seriously as a warning, not just information: Kava. Kava has real evidence behind it for anxiety. Some studies show effects comparable to certain anti-anxiety medications. But Kava also has one of the clearest, most well-documented links to serious liver toxicity of anything in the natural supplement world. Several countries have banned or heavily restricted it for exactly this reason. If you are over 65, especially if you take any medication that's processed by the liver, and that includes an enormous number of common prescriptions, Kava is, in my professional opinion, simply not worth the risk. There are safer tools on this list that get you most of the same benefit without gambling with your liver. This is the one place in this video where my answer isn't talk to your doctor and consider it. My answer is skip it. Let's pause here for a second, because I want to make sure this is landing the right way, not just washing over you as a list of supplement names. If you remember nothing else from this video, remember this: the supplement matters less than the sequence. Get your kidney function and liver function checked before starting anything new. Start with the lowest risk options first. magnesium glycinate, and L-Theanine before moving toward the adaptogens. And never combine more than 1 or 2 new supplements at the same time, because if something does cause a side effect, you and your doctor need to be able to tell which one caused it. So let's pull this together into the actual protocol I walk my own patients through, step by step. Step 1. Foundational blood work. Kidney function, liver function, and a basic metabolic panel, ideally before starting anything. This isn't optional in my book, it's the foundation everything else sits on. Step 2. Start with magnesium glycinate in the evening, assuming kidney function is normal. This addresses sleep and baseline nervous system regulation first, because better sleep alone often reduces daytime anxiety significantly on its own. Step 3. If daytime stress and fatigue remain a problem after a few weeks, consider Rhodiola in the morning rather than jumping straight to Ashwagandha, particularly if there's any liver concern at all. Step 4. Keep L-Theanine on hand for situational, predictable stress, appointments, travel, family events, rather than using it as a daily baseline supplement. Step 5. If you and your doctor decide ashwagandha is appropriate after reviewing liver function, start at the lower end of studied doses and reassess after several weeks rather than committing to it indefinitely without checking back in. And Step 6. The one most people skip. Revisit this every 6 to 12 months. Your kidney function, liver function, and medication list at 65 may look completely different by 70. What was safe and effective last year deserves a second look, not just an automatic refill. I want to leave you with the honest, bigger picture point behind all of this. Stress and anxiety after 65 are not something to just accept as part of getting older. They are measurable, they are connected to real physical processes in your body, and they are genuinely manageable, but manageable in a way that respects your actual biology at this stage of life, not the biology of whoever wrote the supplement label or the influencer who recommended it. If this video helped you understand your options more clearly, please hit subscribe. I put out new videos every week on exactly this kind of practical, evidence-based senior health information, and I'd love to have you back for the next one. And if you have a parent, a spouse, or a friend over 65 who's been quietly dealing with stress or poor sleep, send them this video. Sometimes the most caring thing we can do is hand someone the right information before they go looking for the wrong kind. Take care of yourself, and I'll see you in the next one.